Welcome to Osce learning sessions. Today we will go through New Zealand Osce updates and overview. To improve is to change. To be perfect is to change often. It's a powerful reminder that growth comes from embracing change. I know recent changes in the stations have brought uncertainty and stress. It's natural to feel tension, but remember who we are. We are a skilled, caring professionals dedicated to our patients. Together, we can meet these challenges head on. Staying focused makes a real difference. Consider each station's every patient encounter is a chance to demonstrate your skills and compassion and your adaptability towards such situation. For example, when a patient has a vague symptoms, try to use an open-ended questions to guide them. Encourage them to describe their story. In only one station, in only one station you will encounter an unconscious patient. In all other stations, you will be interacting with either a real person or a mannequin. Even if it's a mannequin, you must verbalize all the critical informations as if it's in a real scenario. Don't expect the same questions or concerns in each stations. Approach each one with a broad and flexible mindset. Always remember, if the patient is conscious, follow the ABCDE protocol. It's a structured, systematic approach that helps you to assess and manage the situations efficiently and safely. For example, when a patient has a vague symptoms, use open-ended questions to guide them. Encourage them to describe the story. Tell me more about how are you feeling now. What else have you noticed? This often uncovers the critical clues. Go for the vital signs check and any changes in the breathing, heart rate, blood pressure, or consciousness are often early warnings that a patient is deteriorating. For any cardiac concerns or for any respiratory issues, you have to keep in mind that after a good history, the next step is the 12 lead ECG. If it's a cardiac event, it can reveal the arrhythmias. You can escalate the concern. Before that, you have to assess the patient by asking or ensuring ABCDE protocol. If you suspect a respiratory or a metabolic issues, don't hesitate to analyze an EBG interpretation. Earlier, ABCDE assessment is a structured step-by-step method used to identify your patient's problem, and we can respond to urgent clinical issues in conscious patients. It helps prioritize patient safety and ensures no critical signs are missed, and it guides us to prompt decision making. It has to be like this way. You have to assess the airway first for any swelling, secretions, any difficulty in breathing. If there, you have to maintain a propped up position or a head tilt chin lift. If the patient is having any trouble in breathing, you have to observe the respiratory rate, symmetry, depth, and signs of any distress. And always check the oxygen level and watch the chest movements. Moving further in the circulation, you have to check the heart rate, blood pressure, skin color, and capillary refill. You have to demonstrate it by radial pulse check and capillary refill assessment. And you have to assess his disability by using AVPU or GCS to assess the neurological status and screen for any changes. You have to check the pupils, limb movements, and orientation to time, place, and date. And ask why is the early detection of confusion is important in conscious patient. And you have to look for any rashes, injuries, signs of infections, or any bleeding. You have to inspect while preserving the dignity. You have to ask for, is that okay if I expose you minimally? Moving further, if the victim is an unconscious patient, if the victim is unconscious, DRABCD is a primary assessment used in emergency situations to quickly evaluate your patients and manage a patient condition. D stands for, as you all know, danger. Check for any danger to yourself and the patient or the bystanders and ensure that the area is safe before proceeding. Moving further, check the patient's responsiveness using verbal and physical stimuli. Can you hear me? Open your eyes. Gentle tap on shoulders. You have to ensure the airway is clear. If not, open it using head tilt and chin lift method. Or you can use jaw thrust if the spinal injury if you are suspecting for your patient. You have to assess his breathing pattern by look, listen and feel. For normal breathing, it should not more than 10 seconds. If not breathing or breathing abnormally, prepare for CPR. In circulations, if no signs of circulation, begin chest compression and rescue breath. Finally, if needed, if you requested for AED, definitely they will bring that. You have to apply an AED as soon as available and follow its prompts. Whatever the situation may be or what concerns your patients are raising first, you have to listen properly, give a pause and then communicate. Think critically about how you would respond to each of these stations appropriately. Don't expect everyone to present with the same concerns or symptoms. Each individual is different. Let's begin training our minds to approach each situation from a broader perspective. For example, if a patient mentions using a particular medicine, the follow-up scenario may vary. One might say, for one candidate, I forgot to bring to the hospital. What should I do now? You have to be prepared for that, right? Another might ask, I have it with me. Can I take it? While someone else might say, I already took it. Is that okay? Think critically about how you would respond to each of these stations appropriately. We will go through each station in detail, so let's stay connected.